Good afternoon, everyone. Good morning, good evening to all brave hearts all around the world. My name is Dr. Darrell Wolf, and today what we're going to be doing is we're going to be discussing about knee problems, okay, and also knee surgery. Now, let's make this really clear, okay? The world does not revolve on teaching you strategies and techniques that are going to give you massive personal healing. How's that? Okay? And the reality is, it's not a case of good or bad, it's just an is, okay? The playing field is not fair for you. It's not fair for 99.9% of the population, because you have to understand something. It was never meant to be fair for you, okay? Think about this, okay? So you went to school for 12 years, you might have went even longer, and guess what? Most of you, even who call yourself natural health practitioners or even healthcare workers or professionals, most of you have been ruled and schooled and fooled, and I'm going to share things with you, and then I want you to ask yourself, well, you don't have to be a genius to know that. Oh, well, that's pretty logical. Well, guess what? I didn't say I was a genius. I said, guess what? If you had logic, okay, but people don't have logic, they're programmed, okay, into ignorance, and that's the God's truth. Okay, I'm going to tell you something right now. We haven't had for years, and you know what? Come on out and tell me I'm wrong. But we haven't had for years somebody go for knee surgery and they were told they were bone on bone, or there was no cartilage left, or they ripped the meniscus, or there was just no way for it to heal. And it's been years since we've had anybody that was even booked for surgery within just even a week or 10 days, and they didn't go. Look, everything that I'm going to ask you to do is not life-threatening. It's not dangerous. I'm not going to cut into you. Wolf Non-Surgical has got nothing to do with surgery. It's got to do with an elbow technique that I put together called Wolf Non-Surgical Therapy back when I was 27 years old. I hope you get this. 27. I'm now 67 years old. And the reality is that, you know, early on in my life, I became an RMT, registered massage therapist, which takes you 2 years to get. As far as I'm concerned, it's the biggest joke anywhere. I do love getting a Swedish massage. Thank you very much. It's an hour long. It makes me feel loved and cared for. But the reality is, unless the body work is actually going in and pulling the beef jerky apart, which is the scar tissue that you got from inflammation, not from a car accident or from a sports injury. But guess what? Do you know what old age is? Old age is scar tissue, and you never had an accident in your life, never were in a car accident, never had a sports injury, but it was created from an inflammatory mind and an inflammatory diet, and that's the God's truth. You know, I know people that are only in their 20s and 30s that are already old, okay? But understand, old age is the absence of scar tissue and the absence of displaced calcium in your joints, in your muscles, in your organs, okay? And the absence of lactic and uric acid piling up in your body. And the reality is what am I talking about? Well, what's a gallstone? Anybody that has gallstones is precancerous. You didn't know that, did you? Well, why do you think you're pulling so much calcium from your bones and now it's in your gallbladder? Because you're so infected, that you're so inflamed, that your body doesn't want you to go into mutation, which is 35% or more oxygen deficit for 3 days. So it pulls calcium from your bones to buffer down and alkaline the pH so that you don't mutate. Are you with me? Because all a cancer cell is a cell starving from alkaline minerals and from oxygen. Dr. Otto Warburg received the Nobel Prize, okay, for the discovery of cancer, which is that your cells are being deprived of 35% or more of the oxygen they need at the cellular level, and you've got mitochondrial damage, which is basically, you know, the powerhouse of a cell to make your ATP, to create your energy, to keep you not just surviving, but thriving and energetic. So it all starts at the cell level. So the other thing too is this whole surgery thing, you know, just look at it. Whether you want to believe this or not, okay, surgery has gone up about 2,000% in the last 25 years. Now you'd have to ask yourself, why? Is the human body different? No. People have more scar tissue. They have more displaced calcium and crystallization because we've never been so fearful. So we're always dumping adrenaline, cortisol, and histamine into the body. So we're becoming acidic, okay? And we're pulling all that calcium from our body. We've never eaten such garbage foods and so much garbage foods in our life. Most people are walking garbage cans, and I'm not putting people down. Why don't you tell me that I'm wrong? Tell me that people don't have this sticking out way out here and they look like they're 6 to 9 months pregnant. Okay, tell me that their large intestine is not hanging down in between their crotch. Okay, tell me that their large intestine, which is the holy grail, 85% of their immune system, is still there. They have no core. They have no core. It's down on the floor. So their back, okay, so the back is going to have what? The back is going to have all the contraction, all the stress, and because you've been pooping in your pelvis here, okay, you've infected your back, and so you inflamed it, and that's why most back surgeries are low back surgeries. And just so you know, the next time I come on and do a do-it-yourself video, it's going to be called Neck Pains and Migraines. And I'm going to show you how to get rid of shoulder and neck pain and how to get rid of migraines. And I'm going to tell you, this is going to blow your mind. Today I'm going to show you how to reverse, or at least, you know, slow it down, okay? Because the reality is this. Most of you have been so scared to touch yourself or touch your family, right? Look at how they programmed you. You know, not only do you not know how your body functions, and it's not your fault, I get it, it's not your fault, but you know, if you do go to my library, which is free, at docofdetox.com, and you watch Reverse the Irreversible, you're gonna go, okay, all right, okay. This is so logic. Why didn't I get this? Okay. If you watch How to Become Number One at the Art of Number Two, you're going to find out a lot. And The Highway to Health, and also The Holy Grail, the large intestine. Those 4 videos, and you'll be smarter than most practitioners you've ever went to. And the reality is I did say smarter. I mean, there's a lot of practitioners out there that have a lot of information. Oh my God, he's so smart, but is he logical? Can he actually give you a strategy? Is he going to turn you from being a patient into a practitioner? That's what I'm going to do. Okay? And I'm no better than any practitioner. I'm no better than anybody on this planet. I'm just trying to tell you, have you had enough of them pretending to you that this is as good as it gets? It's not true. Okay, let's talk about knee problems. Just so you know, I'm telling you the God's truth. I have no need to lie, okay? The reality is this, is that I don't know of anyone that's went for knee surgery that came to us, and we give you a money-back guarantee that on the first treatment, you're gonna go, oh wow, okay, you didn't tell me I had to, but I'm canceling my knee surgery because, my God, you know what? You took my pain that I had in my knee and my stiffness down by 80% in one treatment, Dr. Wolf. And guess what? In one treatment, 80%, and guess what? That pain's not going to come back unless this person doesn't want to listen to what I've got to say about their core, about their diet, about how they think, drink, and eat. So if you don't want to do that, you're just going to go back to it and understand. If you don't want to change your personality, you'll never change your reality. And your reality creates your illnesses. Your personality creates your illnesses. That's right. That's not true. It's genetic. Oh my God. You know, I had a lady today comment on yesterday's video, and God love her. But she said, you know what, Dr. Wolf? I really don't know what to do, and you probably can't help me because I've got hammer toes and I know it's genetic. Really? Show me a disease that's genetic. It's all epigenetic. Now, here we go. So the knee is one of the most easiest things to reverse. Now, it also doesn't have a lot of circulation, but I'm going to tell you, it's a lot easier to reverse a knee for us than a hip. And That was Kimberly, our host here in Bonita, Florida. We're doing a New World Practitioner course, so my apologies. Okay, so hopefully she doesn't call back. This is where I'd like her not to be persistent, okay? So now, the knee, okay, when they tell you that you have to have a knee replacement, hip replacement, when you've got stenosis in the spine, when you've got to have surgery on your ankles, on your shoulder, on your neck, on your wrist, I'm telling you that if you go see a Wolf non-surgical body worker, and if they can't prove to you that in the first treatment that they can give you your range of motion back and they can reduce your pain incredibly, we'll give you your money back right then, or you just don't pay. The reality is, this is not a marketing pitch, so you can say whatever you want about me. But the reality is, I'm trying to tell you, just because you heard something different doesn't make it a lie. Just because you hear everybody saying the same thing and doing the same thing doesn't make it the truth, does it? Okay? So I want you to understand, we're going to go through this, and I'm going to give you techniques to really take control here until you can see a Wolf non-surgical therapist. Now, I'm not telling you that you can't turn this around. You just may be able to do it yourself, okay? And understand, we need you to do it yourself. Do you know why? Okay, first of all, have you ever seen so many canes, so many walkers, so many wheelchairs? They can't get enough nursing homes going here. They can't get enough hospice. Do you understand? So understand this. Any of you practitioners out there, if you're doing any work for people and you can't offer a money-back guarantee on your consultations, if you can't offer a money-back guarantee on your treatment, if you can't offer a money-back guarantee with your trainings, then you mustn't be standing in the power of the things you've learned, because that's what we're going to do, and we're going to do it. And we have to do this, because guess what? That's what they used to do 10,000 years ago, is you didn't even pay the therapist until you had this fixed. And understand something, you need to find a practitioner that's not going to treat you, that's going to train you. Now, the majority of the population is going to be okay with just being treated for the rest of their life, and that's called mistreated. But if you want to get trained, okay, come as a patient, we can relieve your pain, bring back your range of motion, okay? I know we can. And then, but you want to learn what we're doing so that you don't have to keep giving your money to us, and so that you're not reliant on somebody else. You were given a body, learn how to work it. Okay, so here we go. All right. So when we go, I'm going to show you, and then I'm going to talk about some other things, okay? But when you're talking about the knee, okay, believe it or not, these are the things that we can do. Go to my book, Healthy to 100 book, and you'll find that in my library. It's free as a PDF. Look at Healthy Skin, or you can go into the Do-It-Yourself guide. I talk about it there in the library as well. And what you want to do, if you've got a knee problem, please trust me on this. I'm going to be telling you most of this is going to cost you no money, or so tiny. So if you don't have any love for yourself, you're not going to do this at all. If you have a little bit of love, you're going to play with it. But if you really love and care for yourself, or you're in so much pain you want to off yourself, maybe you'll follow through. But the reality is the majority of the population have been programmed to follow through as much as they can for everybody else, but never for themselves, because that would be a selfish act. And you better get this. You've been programmed to be sold off by the pound. How does that feel? And you can say, I don't know what I'm talking about, but I do know what I'm talking about. At least about that. So here we go. So I want you to, I'm going to state things. If you watch my other videos, I'm going to keep repeating. But guess what? Repetition is the master of perfection. And the reality is this. They've repeated things to you that are totally asinine, and we do them because they repeated them enough that you can program anybody into becoming from a human being to a human doing. Yes or no? Really? Really? Take a look at your family, take a look at your friends, take a look at the majority part of the world, and you'll see that, guess what? Advertising pays. All right. So here's the deal. So first thing you're going to do is get yourself a Tupperware container. Next thing you're going to do is, usually Costco has a really big container of this. It's called Epsom salts. You're gonna pour the Epsom salts into the container. It is 10 pounds, okay? It's 10 pounds of Epsom salts. So that would go into the container. That would go into the container. Now you're gonna go, and you don't have to do this, you can just use your regular water. But if you have a structured water unit, pour the tap water through here, wet the Epsom salts down, okay, to the consistency of wet sand. Okay, now if you've got like Pain Away essential oil, Muscle Restore essential oil, or if you've got an essential oil that you love and you know that it's really good for healing, then I want you to pour the essential oil into the Epsom salts container. So you don't have to use 10 pounds of Epsom salts, but these are only for comparison. So if I use 10 pounds of Epsom salts, I wet it down to the consistency of wet sand. I'm telling you this because you can just do that, or we can take a pound, because we took 10 pounds of Epsom salts, we'll take 1 pound of coconut oil, and we'll mix the 1 pound of coconut oil in with the 10 pounds of Epsom salts. Get in there, mix it around, and before you put that in, make sure that you put your essential oils in, okay? Pain Away, Muscle Restore, something like that, lavender, whatever you like. And then guess what? And then what you're gonna do is then you put the 1 pound of coconut oil and you mash it all up. Trust me, I'm telling you that, you know, you couldn't even get this at the spa, okay? And definitely you wouldn't be paying this price. So now, you've got it mixed up. So now what you're gonna do is you're gonna go in to the shower. So let's just focus on the knee, okay? So that's all we're gonna do. You could do this on the whole body if you wanted. Bear with me on this thing, okay? You're gonna go into the shower and you're gonna take the Epsom salts with the coconut oil and the essential oil mixed, and it's the consistency of wet sand. You're gonna take that, okay? And before you start using that and going into the shower, you take this, because you're not gonna do that every day, but you can do this every day. Before you do the Epsom Salt Cocoa Glow, you're going to take a skin brush. This here is a natural skin brush, okay? And it's made out of cactus fiber, and this is made out of hemp wood, okay? This is something that we sell. You're gonna do that, you're gonna grab here, and you're gonna hold your skin a little bit tight, and then you're gonna go in here, and you're gonna really skin brush. Now skin brush for about, really, you think I'm kidding? 3 to 5 minutes. And I can go really tough in here. Some of you are gonna have really dry skin. If you were to sit by like a window where the sun's coming in, you would see all the dead skin cells coming off. You know, the dust in your house is not dust from the street. The dust in your house is from skin cells from people. I won't have a lot because I do this kind of stuff a lot. So anyways, I'm gonna skin brush here, and then I'm gonna go in the back of my knee, and I'm gonna skin brush the sides of my knee and the back, the lymph nodes here. I'm gonna go hardcore, hardcore. Isn't it something how they taught us that you should never, ever, ever touch your lymph nodes? Well, I'm gonna tell you something. You shouldn't just touch them, you should clap them. Wait until I show you what I believe that you should do, but don't believe me. But if it sounds logical, and if you think it's not gonna cause you any damage, then why wouldn't you do it, okay? So now we're gonna skin brush the whole leg. Maybe you don't have time. Then from there, we're gonna go into the shower. Now, you ready for this? Did you hear what I told you about the Epsom Salt Cocoa Salt Glow and how to mix it? You wanna know something? If I had a knee, okay? If I had a knee, and that knee was gonna have to have surgery on it, I might listen to Dr. Wolf, okay? And here's the deal. Take a half a cup of Epsom salts, wet, okay? You're gonna wet it down to the consistency of wet sand. You're gonna put a half a teaspoon of cayenne pepper in there. You're gonna mix that up. Make sure you don't get this in your eyes, it'll burn. And then what you're gonna do is you're going to, if you want, okay, if you want, you're gonna put 1 rounded tablespoon of coconut oil in there as well. And you can mix that all up, or you can leave the coconut oil out. If I took that Epsom salt cayenne scrub, and I scrub in here, that is going to increase the circulation. Yes or no? So even if I didn't have time, but wash your hands off. I don't want to hear that you touched your hands with it and now your eyes are burning and you had to run to the doctor, which it won't do anything except burn your eyes. It's not going to blind you. But I know you're going to run to the doctor because we're all emergency 911 all the time. My God, people have a fever today. They'll go wait in line at the doctor for 2 hours to get their drugs instead of just doing a warm water enema with some black diamond in it. And guess what? The fever would be gone in 15 minutes. Oh no, wouldn't want to do that. We got to make everything into a trauma. And that's the God's truth. You're just boiling over because you're rotten to the core. You got it? Okay. Trust me, I don't mind any doctor, physician, practitioner wanting to challenge me. My phone number is 469-861-8884. Okay? Instead of having them talk behind your back, they might as well come on the attack. Okay? All right? So here we go. So now you could just do that once a day. Okay? And that's really going to help. Okay? But the reality is this, if you really put more personal action into it. So let's say, okay, if I don't do anything else, I'm going to do this. I'm going to do the skin brushing, do it behind my knee. I'm going to do that every day anyways because that's good therapy, isn't it? If I already had trouble with my knee, I might as well get the circulation going. Okay? All right? And then the next thing that I'm going to do, are you ready? Is I'm going to get coconut oil. Okay? I use MCT C60 oil. You may not want to do that. Coconut oil is cheaper. Okay, and you might want to just then put the coconut oil on. Then you can use an infinite iodine bottle like this, okay, all right? And if you don't want to use that, you could use our Bright Eyes Fulvic bottle, it's about the same. Or you could use the IGF 300,000, or just go find a bottle, something like this. Then I'm gonna hold the bottle like this, and then I'm actually gonna come in here, look, watch this. You hold it like this. See this in my fingers? And then yesterday, if you don't understand this, what I want you to do is I want you to go back, and yesterday I did how to do the ankle. Today I'm doing how to do the knee. And if you hang around, I'm going to teach you about neuropathy, about calcification in the Achilles tendon. I'm also going to go through about, one second. What runners get. See, I got brain fart right now. Shin splints. I'm going to go through about how to work the shin splints out, and neuropathy, calcification in the Achilles tendon, and we'll talk about the knee, and we'll talk about how the hip and the ankle affect the knee. Okay, are you ready? Here we go. So now, what I've done is I put coconut oil on here. I did skin brush, okay? After I do that, guess what? We take the side of the knee. Now see, we got bones, okay? What I want you to do is I want you to think about this. It's called, I want you to become a health detective, and it's called search and take apart. So we're gonna I usually pull the skin a little tight here, and I come on the side, and look at, I want you to go in here, and I want you to go into every nook and cranny. Right now I'm underneath the knee. I'm gonna come around the bone here on the side, and I'm gonna work the bone below it, on it, around it, in the back here. I'm gonna work in here, look at. I'm gonna work all of this. I'm gonna break all of this up. Oh my God. You know what? Okay, everybody, just know this. You're actually getting your breast, okay, cut open because you've got scar tissue and calcium. You're actually getting your knee replaced because you've got scar tissue and calcium. You're actually getting your hip replaced because you've got scar tissue and calcium. You're actually getting a rod in your back because you've got scar tissue and calcium. You're actually getting carpal tunnel syndrome, and now you're getting surgery on your wrist because you have scar tissue and calcium buildup. Are you hearing me yet? Are you getting it? It's everywhere in the body, and it's reversible. And I can teach anybody how to do this. And I mean absolutely anybody, anywhere, anywhere. I am a threat. That's correct. Okay, so now we're gonna just come in here. Look at this. When I come back, I'm taking like ligaments and tendons and crystallization, calcification, and I'm bringing it up against the bone, and I'm using the bone as a backboard to break it up. Oh, but Dr. Wolf, I don't want to bruise. Okay, healthy people don't bruise. I can go in here and work as hard as, look at this. Listen to it. I should come closer here. I want you to hear this. How hard I can go when I don't have pain. Do you know who has pain? Infected people have pain. Okay? All right? Infected people. So here, listen. I don't know if you can hear it, but hold on. Can you hear it? I can hear it here. But I don't have any pain. Those are, look at, let me see if I can go back a little further. Yeah, I should stand here. Look at this. Look at how I've got it. Now, there's a bone here and a bone here. I'm not going to give you names because it's not going to help. You're just going to go into the valley of things. Look at. Now remember, I've put coconut on there. Listen, you can hear the grinding, except I don't have any problems because when I travel on a plane, I work on my ankles and I work on all my joints when I'm traveling in a plane. There's nothing else to do. Okay, and now I'm going to come in here. Look at, I'm going to do this whole area. Look, come on, guys. Oh my God. You know, what's going to happen, Dr. Wolf? Well, what happens is that whether it's a tendon, a ligament, or a muscle, those fibers, when you get stressed out, when you don't eat right, when you poop in your pelvis, infection causes inflammation, okay? All right, and what happens is, those nice fibers in your tendons, ligaments, and muscles, they first stick together, and they get stuck together like crazy glue from lactic and uric acid, okay? You got that? Okay, all right, hope you do. And then what happens is, then we say we've got a knot. It feels like I have a knot in my knee or my neck or anywhere in your body. And that's because of dehydration. Everything knots up. Mostly you'll feel a knot like in the side of your neck, which guess what? I'm hoping to do it tomorrow. Tomorrow at 1 o'clock Eastern Standard Time, I'm bringing on Oliver Foxen, who's one of the most brilliant people in the world of researching mushrooms. And we're going to be talking about thunder shrooms, which are 90 years old, which can, it doesn't matter, people don't have to believe it, but whatever. When people get on our C60 and our calcium ion therapy like Merigen and on our thunder shrooms, they get up and leave hospice. I'm not saying everyone. I'm trying to tell you, it's like not a miracle. It's phenomenal, yes, but it's not a miracle. And these miracles can happen every day. So let me go back to this, okay? So what we're going to be doing here, hold on, is you want to be really thorough. You want to, let's say if you got a knee problem, why don't we just do right here, wherever the pain is, why don't we just do that spot and not do the whole knee? Don't do the whole knee because I don't want you to go, oh my God, my knee swelled up. I got to go to the doctor. No, your knee swelled up because you have so much infection, calcification, and scar tissue formation in there. So when you start the knee, just say, oh, Dr. Wolf, my knee is really hurting right here. This is the worst spot. Well, then guess what? I want you to go in here and work for a half an hour to 40 minutes using what we call one-shot therapy, where you take the bottle like this and you go in and you open it up. Look it, guys, you saw it already. Go in every nook and cranny, all around, underneath, even right at the back here. You'll find it. You'll go, oh my gosh, yeah, that's it. Oh, I don't know if I should do it or not. Well, don't be scared. You can't hurt yourself. It will heal. Okay? And go to the point that, and just, sometimes it's better to close your eyes. Close your eyes and just breathe the Lionheart breath and feel it out. And don't become the pain. Be like you're sitting over on the couch and you're watching it, and understand, start pulling this stuff apart. You're just an old piece of beef jerky. And here's where I have it the most, right here. So for me, it's right here, and I felt it, and you can feel it. And I'm just going to stay there, and I'm going to keep working on it. And I'm going to go, look at, you see how I make this into a windshield washer, like a windshield wiper? So I'm going to go this direction. I'm going to come on it this direction. I'm going to go in every nook and cranny until I can't feel that crystallization or those lumps and bumps in there anymore. Look. I'm taking it apart. Now you're going to come down around the front. So look at, I did this whole area here, okay? So now I'm going to come down around the front, and I'm going to come right down. You'll feel your bone. It's a big bump right here. Work on it, and then go under it, right under it. Look it. Go right under it. Make sure you got lots of coconut oil there. Go under it, and you can feel the lumps. Oh, you feel the bumps. So if you've got victimitis, you're not going to be at it for too long. Just pick a little spot this big, wherever you think the pain is for the first time, and work on that and get rid of that lump and bump. Every lump and bump in your body is slowing down the circulation. It's causing nerve pain. It pushes on the nerves. Understand that. If you had no lumps, bumps, or blocks in your body, you would be healthy. So get rid of your lumps and bumps, okay? All they're doing, when you go, like I talk about a lady that I did, and she had a big fibroid on the side of her neck, the size of a large plum. All I did was non-surgical and Cellsonic. We did 200 pulses of the Cellsonic, okay, right on the tumor. And then I did non-surgical on her jaw, the back of her ear, and I did it at the corner of her neck, and then I did it right on the area. And you can go watch this video, and in 20 to 25 minutes, okay, guess what? She didn't have a fibroid tumor. It's not like it was floating anywhere. Remember, it's issues in your tissues, right? You're storing negative emotions and things you can't process. Every disease is you being not at ease with something, because there are no diseases. There are symptoms that are out of control, and then we give them names. And those symptoms is just your body giving you messages that it loves you. So we're going to come around the front. And I'm coming right down. See how far I come down? So I come down about 3 to 4 inches from the kneecap. I work right around to the very back of the knee, and I work this whole area like I just showed you. Okay, and then I'll show you. Then we're going to work down here, right under the kneecap, and we're going to come all the way down. Look at right here. You'll see people usually have a bump right here. Okay, I want you to go in there. Listen, look at this. Let me see if I can get close enough. I want you to hear it. No, it's not too loud. You won't be able to hear it. But I am taking all of that off. Now, just make sure you have enough coconut oil. And then come on the other side. Then come up underneath the kneecap. And now we're going to do the other side the same way. Get underneath every bone, nook, and cranny. And when I come back, I'm digging in and trying to separate the fibers and bring the calcium and the crystallization up against the bone and break it up. And that's what happens. That's how you do it. And the more dehydrated you are, and the more chronic this is, the more drier it is, and the more crystallized it is, the more calcium you'll have. Right? Listen. Hear it? Oh, I don't know if you can hear this, but it's just crunching. Look at. See? Now I'm just going like this. Look. And I'm going to show you how to do the splints in a second, the shin splints. You're going to come around. You're going to be thorough and work the area. So why don't you do what I say, okay, for this one. And today I'm going to work here. Maybe tomorrow I'll work underneath the kneecap. Okay, then the next day I'll work over here, and then I'll work on top. Because with some of you, if it's swelled up, your family would go into panic mode and say, call the lawyer, let's sue Dr. Wolf. Seriously, people are like, whew. Okay, so we're gonna come on this side, and we're gonna do the same thing. See how I've got it? I'm holding it, and I'm using a motion like this. And when I go back, so when you're doing it too, even, you know, how high you have it, or if you have it really close to the skin, it's more superficial work. If I have this up higher, I'm going deeper. So go superficial, and you're going to feel garbage. Keep it lower to begin with, and go all around in the nooks and crannies, in the valleys, right on the bone. Go everywhere, okay? And then just keep working on it. And then you're gonna come around, do this side. You can also go right on the kneecap and clean it. Listen, look at it. I'm cleaning the top of the kneecap. Clean it off. If you took this and you worked your whole body, where do you think you would be? Seriously? In the hospital? Seriously? Okay. All right, so clean the kneecap off. Come on, get rid of this stuff, guys. Oh, well, you know, I've never really done anything for myself. I know. Start practicing loving yourself and find out how 50 trillion cells and 500 trillion bacteria jump up for joy. And then I'm going to do the top. Now, what you're going to find with most people, if I come, okay, so here's the kneecap. I'm going to come to the top of it. Then I go into a little bit of a valley. And about 1.5 inches back, you're going to find a lot of people have a band right here. And that's because, guess what? They weigh more than they should, and they are creating a band here of scar tissue and contracted muscle just to keep their butts standing up. Seriously. Okay, so now I'm going to pull down. I'm going to pull down on the skin to just make it tight up here. And I'm going to go in here, and I don't have it. Oh, right there a little bit. Look at it. You see how I'm grinding it? So you can go, remember what I said? If the bottle's up higher, you're trying to go deeper. If the bottle's lower and you drag it back, it's more superficial. And I'm grabbing it more right here. I can feel crystals right here with myself. They're not bad. And I'll get rid of them. Look, I don't even have any oil on here. Okay, that's because I take Ocean Essentials. I take 10 of those a day. So my body's always lubricating, okay, with essential fatty acids. Most people don't get enough of those, right? Okay? All right, so look at, guys, this is it. And then if you go, oh, I'm so scared, I don't know how to do it. Just do it. You can't hurt yourself. See how I'm grinding this out? Okay, now, so we talked about skin brushing. We talked about using the Salt Glow, okay? All right? Now, I'm going to tell you something. After I did my grinding, okay, what I want to do is I want to clap. But when it comes to the knee, using the clapper here and here, it's too bony. You want to use the clapper on top, right here. I only need you to clap here for about, 3 to 5 minutes, okay? The rest of the knee, the clapper doesn't work well, except the back of the knee. You do want to get, if you want to do yourself, you can do yourself. It's a little hard. You can lay down and try to do it. But if you can get somebody in the family, let's say somebody who doesn't like you. No, I'm kidding. But if you can get somebody in the family to take the clapper and clap the back of your knee, you know your lymph nodes? You know those people with Baker's cyst? A Baker's cyst is just somebody who has a blocked lymph problem in their knee. And guess what? That same person has a big pile of poo. If it's the left knee, there's a big pile of poo caught in the sigmoid area, the last few inches of the large intestine. If it's the other knee, they have a big pile of poo blocked in their cecum. I hope you're getting this, and I'm right. Okay? And it doesn't mean I'm smart. It's just I've been doing something for over 40 years, so I should be able to catch on sometime. Now, so what we do is we're going to clap up top, and you're not going to use the bumpy side of the clapper, and you can buy these from us. This is something we invented, but clapping goes back 10,000 years, so don't think I invented the clapping. Okay, so now we're not going to use the bumpy side here. Okay, I use the bumpy side in other parts of the body. We're just going to use the smooth side on here and on the back to do the lymph node. I don't care if you've got a Baker's cyst. Start gentle and then work into it. But if you have a Baker's cyst on the back of your knee, I need you to go in with the shot glass, with the, the bottle, whatever bottle you pick. And I need you to open up everything and then do the clapping in the back. Now, do you really want to get well? Or do you just want to complain about it? Do you just want to limp? Just know this, guys. From a little bit of pain and stiffness in the knee, we go from there to drugs, to a cane, to more drugs, to a walker, to more drugs, to a wheelchair, to more drugs. Oh, there was surgery in there somewhere too. Okay, you can pick the spot you want. And then just know this, that every time you do surgery, you have more scar tissue in here. Surgery causes more scar tissue than anything else. So if you do get surgery, you may say that you have less pain, but you are going to be lack of motion, when it comes to extension, when it comes to flexion, when it comes to strength, and also you're not going to be golfing anymore. You can kiss that goodbye. You're not going to play with the grandchildren anymore. You may not have pain, but you don't have the flexibility, and you feel like you're going to tear out because the whole thing is beef jerky now. So if you end up getting surgery or you don't get surgery, you want to search down a Wolf Non-Surgical Therapist. This is not a sales pitch. I'm giving you a money-back guarantee no matter what therapist you go to see that I trained. And I will refund the money that you gave them because I know how good they are and how powerful this technique is. Using an elbow, 45-degree angle, will open up all the fibers, will restore the blood, the lymph, and the light energy in there, and guess what? It comes back to beautiful tissue. And they don't want you to know that, because if you knew that, you would never go to surgery, okay? So anyways, here we go. You ready? This is what you got to do for the knee, okay? And understand this. I have people that can barely walk or in wheelchairs because of their knees, and they sit in the wheelchair and they do everything I just showed you, and then they do this. Are you ready? I'm going to do this and show you. You're going to go, oh my God, he's aggressive, he's brutal. I don't know what you're going to say. It depends on how much victimitis you've got in you. The reality is I need you to stop managing your pain and master it. That pain was created by God Almighty as a GPS. And when you feel that you're in pain, it's because you're not loving or caring for yourself, and it's not your fault, but it's your responsibility to find out how, because if you don't, you're going to suffer. This video is about you not suffering and that you deserve a beautiful life. I hope you get that. Now, I'm going to do this. I can't time it. Yes, I can. I've got 150 here. I'm going to go until just 2 minutes. Now, watch. Now, okay. Do I feel the pain? Well, I don't know. Yeah, of course I do, but I look at pain differently than you do, okay? I don't run from it, and then when you run from pain, you'll be in pain for the rest of your life. When I do this, okay, I know that when I do this for 2 minutes, okay, that I'm going to have the best circulation in my knee that I've had in years. I'm going to know that if I had really great circulation, it's going to melt the crystallization called lactic and uric acid crystals. And if I have really great circulation in there, I know it's going to soften up the beef jerky, because guess what? Circulation means that you're carrying in oxygen, minerals, but you're carrying in spirit energy. Oh, spirit energy. You don't know what you're talking about, Dr. Wolf. Yeah, okay. Well, let's try to look at it like this. You're standing outside trying to call somebody inside, but sometimes you can't get the signal in because the walls are too thick, and they're made out of calcium, aren't they? Isn't that what walls are made out of? Is cement, which is calcium. Well, guess what? When you've got too much calcium built up in a joint or in a muscle or in a ligament or in a tendon, do you think it actually brings in the light, the information, the communication, the nutrition, and the detoxification process is stopped? So the reality is when I'm done here, I'll show you both my legs. So this one's not going to be bruised. You might be bruised. So you might only do this for the first time just do it for 2 minutes. And you might only go like this. Because you know why? Because you're that injured emotionally. And probably too because you don't trust me. Because your knee could fall off. But the reality is, it's all about circulation. If a person has perfect circulation, they have perfect health. If a joint has perfect circulation, it has perfect health. Who's going to do this for you? Who is going to do this for you? Okay? You might even, like, you know what? In Mexico, Thailand, around the world, I've got people that are crippled up, and they pay people like anywhere from $2 to $5 an hour to come every day for 2 hours to do clapping on their body, to help them get well again, to get rid of the cane, the walker, the wheelchair, the Depends, and the drugs. Do you understand? Okay? Time is it. Wow. Hey, that was 3 minutes. Okay, so let's see if there's a difference. This one's a little redder. Can you see? It's redder. But guess what? It feels beautiful. Okay, that's what it's all about. I mean, you know, how much circulation does a dead person have? Oh, I think not much. Okay, how much circulation does a healthy person have? So I need you to just always go to logic. Don't go to their BS, okay? Don't go to their BS. All scar tissue can be converted into beautiful connective tissue, whether it's a tendon, whether it's a ligament, whether it's an organ, whether it's a muscle. And understand something, you only have a stiff joint because the same as that door over here, okay, the hinges have rusted. So if I put WD-40, I'm the WD-40, okay? I'm gonna do the clapping. I'm gonna do the one-shot therapy. I'm gonna use my clapper, okay? Now, after I've done all that, guess what I'm gonna do? I'm gonna take a little bit of DMSO, just a little, and on the area that was paining, because guess what, guys? Are you ready for this? If you just did what I just did, you don't have any pain. So you're gonna have to remember, you're gonna have like a tingling and your knee will feel like it's on fire, okay? So what I want you to do is I want you to use the DMSO, but if you trust me, we got one more thing we need to do. So after we do this, do you want your knee better? Okay, after we do this, I want you to, if you, okay, it's a little harder, but if you have like a hose on your shower, I would like you to turn it on and put the water on in between warm and hot. And I want you to put it on your knee for 3 minutes. Then I want you to turn on ice cold, as cold as it can go, and go 1 minute on the knee and make it ice cold. And then I need you to do that 3 minutes and finishing with warm. Okay? Now, what do I want? That's what I want you to do. And if you could do that 3 times a day, just know this, guys. Okay? Are you ready? I don't care what kind of problem you have. If you really are a Braveheart hero of your own story, you're going to reverse this thing, okay? And, you know, check out and find, if you can find a Wolf non-surgical therapist in your area. And if they have a Cellsonic and they can do Wolf non-surgical, you're going to say, this is a bloody miracle. And then you can go home and then you kick in all of this work, because it's teamwork that makes the dream work. So now what you're gonna do is you're gonna take DMSO, and remember the area that was bothering you? You're not gonna do your whole knee. There's no need for that right now, okay? Just let the rest be. But let's say I had trouble on this side. You know what I would take? Let me show you. DMSO gel, you can buy it on our website. Take a look. You see it's just a little bit on the end of my finger. That's all I needed. No more than that, everybody. So I'm gonna take that and I'm gonna rub that, look, just a little bit right here. And I'm gonna rub that on the area. Oh, I wanna show you something, guys. Ooh, you wanna see something? Oh, Daryl, you're not as healthy as you think. I gotta show you this. Okay, remember when I went on the side of my knee and I said, oh my gosh, I feel something under here? Look at this. Now, for those of you who have been trained in the world of what we call healthcare, that's not really healthcare, you're gonna think I'm crackers. Okay, here, watch this. I don't know if you can see it. It's too dark. I really would love you to see it. Let me see here. Bear with me. I'm gonna grab a phone and turn my flashlight on. I want to show you that I've got 3 spots on the side of my knee that bruised. Okay, which means, guess what? That I'm not as healthy in the knees that I thought. 1 second. Turn on flashlight. Turn on flashlight. Okay, let's try this. If I can't show you, I apologize, because I really would love you to see this. Let me see. I don't know if that's going to work. I want you to see. Look, guys, can you see right here? Let me see. Yeah, you see right there? There's a little blue purple, and a little blue purple thing there, and one there. So guess what? I'm going to tell you something. Anything that's called really healthy tissue doesn't bruise. Does not bruise. So my tissue was not that healthy under here. And that's when I was going pretty hard, and I found that, and I said, oh, there's something. Understand something. I will search and destroy every lump, every bump, every displaced piece of calcium, scar tissue, and lactic uric acid in my body, because these are like beaver dams, slowing down the circulation. Old age is that. Hey, Grandpa, you look like you're stiff as a board. Are you okay? Are you in pain? Nope, don't feel a thing. Okay, but he's got osteoporosis real bad. Everything is beef jerky. His nerves are all wrapped up with scar tissue and calcification. That's why he doesn't feel anything. Okay, all right. Anyways, just know this. Most of your family are never going to listen to you. God loves them anyway. Be very patient, because most people have been programmed to the point that you have to understand something. The human brain works like this. If it hears something hundreds of times, it believes it. If it hears something just a few times, and even if it could save someone's life, usually people will not do it, because guess what? That's how we run. And I really believe that the human brain was manipulated in a lab about 150,000 years ago, because why in the world would 90% of our brain be subconscious, where they could put from 0 to 7 programs into us that we get rid of the unconditional love and care that we had when we were first born. Okay, anyways, I'll get off that topic. That's for another day. But I will be coming back on here, and I will be showing you how to get rid of neck pains and migraines. And I promise you, you're gonna love this. Let's go, we're almost done. So, I told you already, a lot of people have problems with their Achilles heel. Okay, Achilles tendon, it's their Achilles heel. And it becomes their Achilles heel. And that's because of crystallization and calcification settling in here. So you have to go in with what I showed you with this technique, and make sure you use the oil, and even get somebody in your family to do the same technique and go in here and break up that calcification and crystallization, but use coconut oil on that area. And also you can put DMSO on there, especially if you've got a lump of calcification and scar tissue. Put a little bit of DMSO and then mix on there too, just a couple drops of C60, okay, coconut oil, and then just a couple of drops of essential oils. I would be using Pain Away or Muscle Restore. And then what I would do, what about bunions? I just did bunions yesterday. If you go to, I explained the whole thing. It took me like 10 minutes. If you go to ankle restoration, you're going to see it there, okay? And everybody else, I'll answer your questions on Facebook here as soon as I get done, okay? Because I can't do that right now. But you want to go in here and you want to mix a little bit of DMSO, and if there's a bump, you put a little bit of DMSO, and then you put 2 drops of, let's say, Pain Aware Essential Oil or Muscle Restore, and then 2 drops of what we call Bright Eyes Nano Fulvic. And then what you do is you take 2 drops of C60, and you put that on like one of those little round Band-Aids, and you put that over top of the calcified scar tissue area, and you let it soak. So, because DMSO, which I didn't tell you if you're new, DMSO is made from pine trees, and it is the most powerful solvent. And you can believe me or not believe me, but there's people do not make a DMSO like we do. There's a lot of crappy DMSO out there. Now, the DMSO liquid's not going to work. You got to get the gel. And then we also have DMSO rose cream for more tender areas like your breast or your face. But don't ever touch your eyes with it, because it'll burn your eyes. Do you understand? Not burn them out or blind you, but it'll burn just like the cayenne would. Okay? All right? So the DMSO, you don't need to use a lot. You want to do DMSO at least 3 times a day. But on that area, you would put that on a Band-Aid and leave it there all night long, and you'd do it every night. And eventually, that DMSO and the rest that I told you to mix is going to decalcify, de-scar tissue, and it's going to fall apart. I'm telling you it will. And go to the other video yesterday about the bunion. I gave you the whole key on that. Okay, so that's that. Now, just know this, neuropathy, All right. Neuropathy is not fun. And mainly people get it when they're older. Now, the problem is with neuropathy is that's the whole scar tissue calcification wrapping around the nerves throughout and the arteries. This becomes, I like to call this stump leg. It's just like a stump because it's so fibrous and so thick with calcification and crystallization. That person needs to get clapping. I showed you the clapping today, but that person needs to go and get Celsonic, non-surgical, and if you ever really want to fix yourself, this is not the sales pitch part. Because understand, calcium ion therapy is the only calcium product in the world that will take, listen to this. If you go to my library and you go into the calcium ion therapy guide, I will blow your mind with every autoimmune disease. Calcium ions, by the time we're 30 years old, we don't make 70% of what we used to. I take this twice a day, so I continually make it as if I'm young. You do calcium ion therapy, especially the Merigen, it's strongest. And if you had a knee problem and you were doing this 3 times a day, and the IGF 300,000 3 times a day, and you were doing Ormus, Beyond Ormus Minerals, and you were doing this work, we're gonna get a brand new knee. Because this is the only product in the world that will actually take the displaced calcium, put it back into the bones, and it'll actually take your bones Swiss cheese-like, and it will restore them. The average that you'll see restoration is 30% every 3 months if you do what we ask. And if you get a Perfect Day consult so that you stop terrorizing yourself with your mind, what you drink and what you eat, and a Perfect Day consult from us is $150 for lifetime support. You'll never see that again because nobody offers that. And you'll also get this. Here, I'll show you. I just want you to know that I am trying to be a good guy here. I hope it's working. You'll get this manual. This is a Perfect Day manual that I put together over 45 years. You'll get it in a PDF form. And if you want to buy the manual, then only people that can buy this manual are people that had the consult. Okay? And it's got, this is the most powerful health book, I believe, on the planet. And then why don't you tell me if you ever get the chance to read it, okay? It's got all the strategies and protocols to take your life back and more. There's more information in here than the practitioner you probably go to. And it's, anybody can understand it. There's no big medical words because big medical words are to make you feel like you're a dumbass. Excuse my expression, but that's all it's for. Fibromyalgia just means pain in your muscles. Arthritis just means inflammation in your joints. Colitis just means inflammation in the colon. Okay? Chronic fatigue just means you backed up your bowel and you backed up the poop so bad in your bowel that you clogged your liver up. Do you want me to keep going? Okay? Eczema just means fungus has gotten so bad from your large intestine and it's leaking into your blood and now it's coming up through the skin. Okay, psoriasis is just the big brother of eczema. Do you want me to keep going? All of these are made up. These are just symptoms of not knowing how to love and care for yourself, and again, it's not your fault. So you take Merigen, and what it does, well, it does over 120,000 processes per second, hormonally and chemically. Okay, all right. And if you want this product, you have to call in our 800 number because the FDA will not allow us to put it in our store so you can just buy it. They can't stop us because it's non-toxic, no side effects. But if I were to tell you what this can do right now, you wouldn't believe me. So why don't you go into my library, go into calcium ion therapy and find out that if you did what I just said yesterday and today and every day by taking massive personal action in your own healthcare, and then if you also take a look, you'll find out things. And this is, I don't mind being judged, guys, so go right ahead. People do it anyway. But the only humic fulvic in the world that doesn't use chemicals in processing is Dr. Detox. The most powerful C60 in the world is ours, and it's the purest, and we can prove it. You go into our information, you're going to find out. Okay? We have the highest vibrational concentrate minerals. It's called Beyond Ormus Minerals. It's an Ormus product. with the highest electrical charge minerals in the world that come off of the glacier melt off in Antarctica. And nobody has that product. Our daily cleansing tea, you should be taking it every morning and every night. And guess what? Your holy grail, which is 85% of your immune system, would never be under attack, and you wouldn't be pooping in your pelvis and having 100 different symptoms thinking that they're all diseases, when all you had to do is look after the holy grail. So I could keep going, but I think I've said enough here today and enough information. Tomorrow I'm going to try to do neck pains and migraines, but I will be on at 1 o'clock tomorrow with Oliver Foxen, and I hope you're ready to have your mind blown, because I just want you to know this, that 95 to 98% of all mushrooms that you take are 2 weeks to 6 weeks old, and they've been grown in a lab. Our thunder shrooms are 90 years old. They grow on the sides of trees, and they are the most powerful thing in the world to actually reverse the immune system and bring it back within just a few days in most cases. And I don't make this stuff up. We have enough research to prove everything. Nature's beautiful, and you're beautiful. And let's just say this. I want you to repeat this to yourself all the time. I am love, I am healed, I am Braveheart. I want you to go take a look at our oath and say it 10 times in the morning. Go and find our oath. It's in the Perfect Day. It's in the 12 loving steps in the library. It's in the fasting guide. It's pretty well in every guide, the Braveheart oath. And say it 10 times in the morning and 10 times at night. And I'll tell you why. I'm not trying to get you to join us. I don't want you to join us. I just want you to join yourself. I want you to find your authentic self. I want you to dust off your passion and purpose, and I need you to gift the world with it, please. That would be your smile. That would be living in the present moment, the only place that you can heal. So here it is. I am love, I am healed, I am Braveheart. Today and every day, from the moment I rise until I gently close my eyes, I will totally love, honor, respect, protect myself first and foremost before anyone else or anything else. So help me God. Because I am, I can, I am Braveheart, I am healed, and I am love. And I need you to do this, because guess what? What if you unconditionally loved and you knew how to care for yourself? What would that do for your family, instead of you crapping your drawers when you hear that somebody's got cancer, or they've got diabetes, or they just had a heart problem? And you could actually give them logic or send them somewhere to get some logic. And then if they don't want it, don't be upset, because guess what? The hardest thing that you will do today is unconditionally loving yourself. Try it. Give it a shot. 3, 2, 1. We got this, Bravehearts.